Good afternoon and welcome to Bold TV. My name is David Grasso, and this segment is brought to you by Engineered Tax Services, where engineering and accounting come together. Joining us via Skype is a friend of mine, Karyn Turk, and she's the host of Red America Radio, and always ready to go, Karyn, aren't you?
I'm ready to go. Let's go.
Oh man, this is a hot potato. According to the USA Today, the U.S. spends half, yes, you heard that right, half of our federal tax dollars on, get this, health care. So, Karyn, here's an easy question. Do you think this amount is too high?
Yeah, I think I want to throw that potato away. I mean, I think America's system is completely broken. Our Medicare system is completely broken. And all of these people that are preaching for elections, Medicare for all, are really doing a disservice to all of us as consumers and Americans, because there's absolutely no way this can work.
And you know, right there where you're sitting in the state of Florida, I used to work in state politics in Florida. You realize that half of our budget is also Medicaid at the state level. So this isn't just a federal problem. All the states are spending too much money on healthcare as well.
Yeah, it's an American problem. I mean, this is something that we all need to be looking at, and we need to raise our voices as patients and as consumers to make major change. Because, you know, even as optimistic as I was, I'm going to say something good about the Obama administration here, is when they first came out with Obamacare, I was optimistic. I was actually optimistic that maybe someone was going to be able to make a difference in this whole system. And as we know, that was a huge failure. But you know, there's got to be something. Something's got to happen. We need more transparency. And I heard that there is a bill now that's going to make that happen. And I know the president's working hard to bring some light and shed some light on this very serious issue.
Yeah, so why do politicians want to double down and feed the monster? You know, all of these plans, while Obamacare was notable for covering people who needed coverage, and that is a great effort, they never really addressed the cost of care. Right? So now we're talking about Medicare for all. Why is there a push by some politicians to spend more and not address the primary problem, which is, of course, the cost of care?
It makes no sense. It's all about elections. That's the entire thing. And they don't even mean what they say. And that's what's really upsetting to me. And, you know, these Democratic candidates that are out there, they're actually doing a real disservice to their own voting base. I mean, they're really hurting the people that they're supposed to represent and work for. Because at the end of the day, there's absolutely no way that Medicare for all can work. The numbers don't work. But the reality is that it sounds good, it feels good, and their voters are motivated by things that sound socially acceptable. So they throw these things out and they can't back them up.
Yeah, and what I don't understand is why you would want to reinvent the wheel. And I feel like Joe Biden has been the only person on stage who's been rational. You know, most people are covered. 90% of people in this country are covered, and a lot of them have employer-provided insurance, which is, quite frankly, excellent. I happen to be one of those people, and I do not want government-provided insurance. I feel like people who don't have coverage should get government-provided insurance. But why do we want to make everyone the same? What's going to happen if suddenly everyone has the same insurance plan provided by the federal government?
We're going to have a major problem. It just can't work. I mean, it's that simple. I can't even put it any more simply than that. It just can't work. And, you know, you are one of the lucky ones. People that are getting, you know, private health care through their employers at this point are in a lot better position than those that are relying on the system. And typically governments don't do a really good job of being able to manage things like this. So why would we even consider going to a system like that? What we need to do is create market competition and making things where they're scaled would be a lot better for the American people.
Yeah, and let's talk about another problem. It's not just federal governments and state governments that are bogged down with medical costs. Consumers are bogged down by medical debt. And you know, anyone who's interacted with the healthcare system knows that a massive bill is coming. And all of that money is entering the system, and no one seems to be doing anything about it. Do you think that Medicare for all is the reason why, or rather that people are wanting Medicare for all because of this?
Medicare is broken. They don't want this. What they want is a cheap alternative to what they have now. They want something for nothing. That's the problem. And the problem is that they are appealing to these voters that really want something for nothing. And the reality is life isn't free, and healthcare isn't free. And healthcare is so much more, has gotten to be so just tremendously expensive that the system is so broken that we can't fix it. We have to really kind of throw out the rule book at this point and go back to basics And I really truly believe if we create some market competition between insurers, we will drive costs down. But we also need transparency for these hospitals that are making these huge profits. If you look at the past year, these hospitals are profiting like they never have. And that's because of this extreme cost of care. It's a real problem. And the option to fix it is not, hey, give us something for free, let the government handle it.
So Tennessee recently moved to cap the amount of money they spend on Medicaid in that state, and other states are considering similar measures. Do you feel like we should have caps and say, hey, this is what the government is willing to put up for healthcare, and it should not exceed this percentage?
I hate to say that. I don't think that's the answer either, because the problem that you have is once you create these caps, there are people who are going to suffer because we don't have another plan in place to take care of those people. The system is broken. That's the problem. The system is completely broken. Those people are going to fall into a donut hole of sorts, and they're going to be remaining uncovered. And all that's going to do is hurt the system as a whole, because they're going to be walking into hospitals and looking for care and end up not paying their bills. And they're going to drive up costs. So we have to
Which
find
is the
a way.
whole problem in the first place, Karyn, right?
It's the
Is that
whole
very
problem.
few people actually pay those absurd prices. But
Right.
if you're not careful, you get stuck with those. If you transition from one job to another, if you end up uncovered, the cash prices are way more inflated than what the federal government or insurance companies pay.
Absolutely. And that's the problem that we have. That's why we have to create market competition. We need to fix the system. We need to get insurers where they want to provide care and they're driving down costs. And we also need transparencies at this hospital level and at a doctor level. And one of the biggest problems that's never talked about, I don't understand why, is the cost of litigation and malpractice insurance. The reason that these doctors are driving up costs so high is because Americans are suing at a larger number than ever for litigation and claims, from accidents to malpractice to other things. We need, on top of this, some sort of tort reform as well.
Well, you would be amiss as a Republican not to mention that, Karyn, because, of course, that's the primary driver for Democratic donations, of course, are lawyers.
Yeah, it's true. It's true. It's true. And I am a Republican, but, I'm also a moderate Republican in the way that, I believe that fiscal responsibility is the way to go. I'm a libertarian when it comes to a lot of things. And one of the things that we should all be able to agree on, I don't care what side of the aisle that you're on, is that we need to fix healthcare. It is broken.
So before we end, I want to mention that healthcare is 20% of the American economy. So when these Democrats propose, socializing the whole thing, what do you think that would do to the general economy?
It's an impossibility. We'd have no economy. We'd be completely bankrupt as a country. That's the thing that's so ridiculous about it. This Medicare for all thing, the numbers don't work. So we would be completely broken. Our economy would be in the toilet.
Yeah, I think people fail to mention that. Very spirited conversation as always, Karyn. Love to see you being moderate and pragmatic, and I hope to see more of these ideas coming out of the mouths of my congressmen, senators, our president, and everyone else. Thank you so much.
Hashtag me too. That's a great.
Oh God, maybe not that hashtag.
Hashtag me too.
Have a great afternoon, Karyn.
Thanks.
And thank you all for watching. Have a great day.